Yeah.
I can't read them on the mic.
Okay.
Okay. What is the title?
I can't read it either. Building solidarity and closing.
Lupe's got it. So what we're gonna do is
Okay,
Thank
let's
you.
do it. Yeah, let's
Yeah,
do it.
is that okay? All right, and this afternoon, we hope you all have enjoyed your day very much, and all the sessions and all the amazing speakers and presenters. We want to thank all these amazing panelists that are joining us here today to have a conversation around building solidarity and creating sustainable pathways towards health equity through community collaboration. So thank you again, and a round of applause for them.
We're going to be super cash. I'm so grateful to be here with all of you, and most especially the trust and faith the Planning Committee put me in to facilitate your stories. They are meaningful and important, and I hope all of you will listen for what you can do after this conversation to take action from these folks who have blazed their own trails, facing adversity and challenges the whole way. This morning's experience resonated in so many ways for me. The peace that I felt the most in my heart was when they were talking about fear. I have incredible fear, but I don't show it professionally. Sometimes the worst part of fear is trying to hide it. I'm going to ask each of us, if you so choose, to say what you're most fearful of right now and scale it on 1 to 10, and I'll go first. I am scared and fearful of speaking openly in the state of Vermont for a lot of reasons. I feel protected at CVPH and feel less protected in the state of Vermont. But I'm back because it's my home state and I love it the most, and because I was asked. But the scale is an 8 for me.
Why am I so nervous? Everybody who knows me knows I'm not. But so what I fear the most is being outspoken and advocating for the difficult situations, and then that being used against me, as far as me advancing in my career, friendships, or daily life in general. Oh, a 10.
So I think my biggest fear right now is through the work we do around advocacy, causing undue harm. I think one of the things that we're working on right now is creating a collated list of projects and ideas of folks working together so that we can create more cohesion between the work to make sure that we're maximizing resources. And I have fear that in doing so, in our current political climate, could potentially put people at risk unintentionally. And I would say that fear is also a 10.
First, I'll out my privilege that I pass as an oppressor, and being somebody assigned female at birth, that's a weird place to be. But with that privilege, I refuse to put energy into fear. So I actually am leaning into Faye fear for my pronouns and trying to absorb that fear and be a beacon to hold it and channel it and dissipate it and resend it out with joy and pleasure. So again, I say that with a lot of privilege, and I've spent too much of my life in fear and anger, and I've chosen to re-channel that in other places.
Hi. I don't know. This year I turned 64. I had cancer and I don't have it anymore. So I'm not really frightened of very much at all. That said, I'm absolutely terrified that Trump is going to get in, and that will be a 5 million billion trillion on the scale.
So I don't have anything so dramatic, but I've been in Vermont for 4 years, and I want to stay here until I retire. However, I fear leaving my small little community I live in, because it took a long time for everyone to become adjusted to having the one black person in the neighborhood. I faced ridicule for my skin tone, the way I sound. Uh, and so I feel comfortable now because everybody in the neighborhood has seemed to accept me for who I am. But however, my small apartment, I've outgrown it in the 4 years, and I want to move. And every time I talk about relocating, they say, oh, you'd be more comfortable living in Williston or go to Burlington. I didn't understand that for the longest time until I came to Burlington. I saw, well, so many people who look like me. But it's not where I want to live. So that's my fear. Oh, my number is it's 10. It's like a huge anxiety for me right now because I've outgrown my little 2-bedroom apartment. And so where do I go? So it's a 10.
We could just end the panel there because all of these folks are about to give you a gift, because what they do every day is face fear or change fear or navigate fear or make it something different to keep pushing forward and talk about it. So I designed some questions. Dr. Wells, Katie, how do you perceive your DEI work as a white, professional, cisgender person with power and privilege? How do you think systems and practice should be built? And what can others do to propel your work forward?
It's a lot of loaded questions right there. So I do often say I am a cis white woman from Georgia, rural Georgia. I often get asked, how did I get to Vermont? I came to Vermont because I felt like Vermont was different in the sense that we had an opportunity to change the way things always have been done. I think when I started thinking about academia and medicine in particular, as a clinician, I wanted to do things differently than what I had seen at other institutions. I wanted to think about, how do we do this with a community-based approach? How do we do this with innovation, with cross-sector relationships? How do we think outside the box of the way medicine has always been done? And so I think the way that I try to show up is really trying to figure out, how do we create collaborations with communities that are meaningful? How, as a white cisgendered woman with a lot of power and privilege, how do I get voices to the table that have not historically been there, and how do I keep them there once they're there? And I think the work that we all try to do every day, and when you say propel my work forward, it's not my work. It's the work of everyone in this room. It's the work of the communities that we work for and with and alongside. And I think it's, how do we propel the work forward of these really incredible community partners? I think about Vermont Language Justice and Allison Seeger. In the height of COVID, which she'll be able to talk and speak to, but I know you won't toot your horn the way that I'm about to. We were losing folks in COVID because we could not have translated materials to get to folks in the urgency of which we needed to do. And Vermont Department of Health did an amazing job with the rapid fire of which we were in. But from a hospital network system, from the Vermont Department of Health, we needed to get information to people quickly and fast that was accurate and culturally contextual. Allison and Vermont Language Justice Project saw that need, stepped into that gap, and rapidly created these videos with cultural contextual information that transformed people's ability to get healthcare access, unlike anything we had ever seen before in this community. So when you talk about wanting to propel work forward, support Vermont Language Justice Project. Help them make videos that get healthcare access, create equity by increasing access to information that is accurate and correct and right. And so how you propel that forward is you support programs like Vermont Language Justice Project.
So Katie just did the thing that she does, which is, I asked you about what you do, and she talked about what Allison did. And one thing that I have seen you do over and over and over is put other voices first and raise up voices with your power and privilege as a white cisgender woman in power and privilege. And we all appreciate that. Brandy. Brandy and I had a very intimate conversation in my office a few days ago about this topic, and it was very deep for me. So my questions for you are, what challenges have you faced delivering best practice advocacy for patients as a woman of color in a system built on marginalization and oppression? And then after, what implications has that had on you and your well-being?
That was a long question first. So the best way for me to answer this question is to speak from my experience. I stated before that I grew up in the city, so racism was not very prevalent. It was not as open out as it is when I moved to the North Country. It was my first time experiencing racism. So when I started inside the hospital, I started on a lower level and I worked my way up. I received microaggressions regarding, your hair looks too thick to be in that hairstyle. Why are you so loud? Brandy has RBF, which we know a little bit about what that means, or she can be a little bit aggressive. That is my culture. That is who I am. You won't understand that until you get to see me better. Moving into advocacy, into a leadership role, I am the first Black advocate since the foundation of patient advocacy. So what does that look like? There is no one who will ever look like me when I walk into a room, as far as when it comes to advocacy. How will my fellow co-workers acclimate to me? Are they going to be able to understand me? Do they know that I talk with my hands? Sometimes I get excited and I'm up here and then I'm down here. Am I going to be too aggressive? So I began to code switch as I would walk into rooms with leaders. It wasn't until Legita and then Zadie Laughlin pointed it out to me. Be who you are. Code switching does no justice for you as an individual and for the people you're standing up for. So I needed to do some research on what code switching was and how is that behavior affecting me. It showed me that I was not being myself. I would not speak up. I would walk into a room and look for my people. And when I say look for my people, at that time, looking for people of color. And then I would go and stand next to them. Now I can walk into a room and I can just point my people out. And I'm not looking for just your color. I'm looking for how we connect together, how you have helped me, how I have helped you, what the connection we have together as far as we're doing the work. How do I feel oppressed in my role? I live in a predominantly white town. When I walked into a patient room one day, she immediately saw me and she said, "Oh no, I don't want no here. I don't want in my room." I immediately took a step back. Obviously, I was taken back. She was an elderly patient. So recognizing that the time she grew up in, that was acceptable. Sometimes trying to change that elderly patient or trying to degrade about how wrong of what she's saying, it's not going to work. It's not going to help us. It's not going to get her the care she needs. So we talked about that on the floor. I took a step back and I let one of my other coworkers handle the situation. I applaud multiple staff members. "Oh no, she can't do that. That's not okay." They came for bat for me. But how does that look on the other side? Now what are we doing to that patient? Because now we are misjudging that patient's family. "Oh, that's the son. He's probably racist just like his mother." Not knowing that she has dementia. She has other things going on, and that is the time she grew up in. That may not be the person she is, but right now that's what she's reverting back to. So there's good sides and bad sides regarding being in advocacy. What implications has that had on me? I do advocacy mainly for the ER. And anyone who works in the ER can be, it could be a strong ball game. So what I want to address is we experienced a traumatic event in the ER. And mother, unborn child, they did not make it. Long story short, I helped support the family. I helped support the significant other in this, in the ER. A month later, I get out of my car and I'm looking down and I go to look up to hand the guy my keys. And it's that same dad. It brings back the memory of what we saw in the ER and what we did to try to save that mom, her baby. He looks at me, I look at him, and we want to talk. We want to say something to each other, but we don't want to cross that boundary. So on the inside, on the outside, I'm standing there and I'm tough and I'm just trying to present a brave face. But on the inside, I'm like, oh my God, what do I say? What do I do? Don't look at me. Run, flight. What should I do? I wanted to get back in my car and drive away. But recognizing in that moment, we live in this community, I work in this community, I'm going to run into this. How am I going to make this better for myself? I sat in it. He did my car, he came back out, he gave me the keys. And right before I went to pull off, he stopped me again. He said, I know this is very awkward, but I want you to know, thank you for everything you did. I said, I didn't want to bring it up, but I wanted to see how you were doing. He said that meant a lot to him. So that's how it's hard to turn it off. You're going to run into it into the community. What do we do about that? Because still to this day, that was months ago, and bringing it up, it still affects me. We are doing the work, but what about us? Sorry.
Thank you, Brandy. Allison, how have you incorporated creativity, critical thinking, problem-solving skills into DEI growth and development?
Thanks, Katie. I'm the founder and director of the Vermont Language Justice Project. And Dr. Carlton asked in the opening kind of address, where do you want to spend your life energy? For 35 years, I was a social worker. And like Katie said, when COVID hit, I was a social worker online with clients, many of whom were refugees. I have a daughter whose first, second, third language is English, and I have very close family friends who also have limited access limited language access. And so I knew when COVID hit, I had to do something. It wasn't like, it's another day, I don't know what's going to happen. I knew that I needed to act. I happened to be a filmmaker as a side gig, so I knew how to make videos. I was really connected to the community, both personally and professionally, so I knew who to reach out to. And so that's what I did. I combined everything that I knew how to do as a social worker, kind of a community social worker. I'm just reading what I wrote. And really how I kind of live really try, sometimes I fail, but how I really try to live my life is I can't be free unless everybody's free. And I feel that really, really strongly. I feel that really strongly in everything I do when I do this work and as I try to live my life. And I think about the time of COVID, and I think if everybody around me doesn't have the information about how to be safe, how to take care of themselves, how to take care of their families, then we're all screwed. It's not just them that are screwed, it's everybody. And so I can't just be free of COVID and not have everybody around me know everything that I need to know to be safe. Everybody has to be free. So that's kind of how I live my life, really, and I really try to do that. Just to live another little plug for my project, I think we're the only project actually in the world that is doing the work that we're doing with the breadth and the depth that we're doing it in. We work in 19 languages that are spoken here, including English and ASL. And surprisingly, our English videos have a lot of hits. You'd think that everybody who speaks English doesn't need to have the information that people that don't speak English or understand English need to have, but that's not the case. So we've had over 280,000 hits of our videos. We have 1,900 subscribers to our channel. The project is growing. And I think it just speaks to what we've found the gap. We found one gap, and what could be more important and what could be more I wrote here, nothing creates an inclusive community like language justice. There we go. That's what I think. And there was another question that you asked before when you wrote to me an email.
How have you remained so brave and courageous?
And I
Through-
don't think I have been brave. I think what
I
I've
thought
been,
you were going to say that.
I think I've just been persistent, and through my whole time working, and I work primarily at the Howard Center, I would put up my hand at every meeting and I would say, are there going to be interpreters present for the meeting? Do you have interpreters? Is this going to be translated? I did that for over 25 years. And I feel like I'm not brave. I run the risk of people like categorizing me as like that person that's always saying the same thing, but I really don't care. I really don't care. And when we talk about bravery, I'm not brave, and I don't have fear to do that because it's the right thing to do.
Thanks, Allison. As a side note, when you told me what you wanted to talk about, you never told me you were brave or courageous. It's just what I heard. And so I knew that you were going to say that you didn't feel that was what you were doing. But persistence is also important. Yeah. We persist. Cal, can you tell us your understanding of intersectionality and how it moves the needle?
Yes. I work over at the Pride Center of Vermont in the health and wellness programs. And for many years, identity politics has been the name of the game and how they've divided us politically to create infighting and scarcity models around money. And now we're in this intersectionality jargon, which for me, when I look at harm reduction, people-centered care, and everyone's a unique individual. Earlier in the day, we opened up with listen, building relationships, and collaborating. And there's so much in our stories that connects us. And I think the power of storytelling is a way for us to get to that intersectionality in a way that the demographic SOGI data will never. Yes, important to gather the data, but we need the practices to shift and we need the culture to shift and to connect with each other. A big word like intersectionality, it's not going to mean anything unless we shift that value behind how we're connecting to each other. For me, I'm a fire sign. I move really fast. I'm an Italian Sagittarian. I like to burn things. Sometimes that's good. There's a lot of bridges that we need to burn. But I'm also not always mindful in those moments, and there can be harm in those moments that I don't want to call it a microaggression, because when you've been misgendered 15 times a day, it's macro. That wound is open, that wound never heals. And when I'm in that trauma loop and I'm hearing language, whether it's my name pronounced wrong, the wrong name that I don't use, you're not using the pronouns that I need to hear to be seen and validated, it keeps me out of being present with you. And I'm not able to build a relationship with you. And when we can't build a relationship, we're never going to build trust. When I look at UVM as a network, the type of intersectionality that you all cross as 14 hospitals, 13 hospitals, you're in rural regions, you're in most of our major cities in Vermont, and the potential to move network level change is incredibly important. If one by one, we're going to try to change the culture of intake forms and have one organ screening, that's like 100 years worth of work. To do that as a network and shift those models collectively to lift that work up, that's what intersectionality does. It doesn't say, hey, okay, this population of people living in Vermont, like, you speak this language, you look like this, what are your needs? Yes, gather that information, but then keep dreaming and sifting it to a higher level. When I ache for something in Vermont, it's dream spaces where we can be free out of all of our boxes and just up in the clouds and dreaming and visioning. We're not really actually currently assessing where we're at well. We don't like to talk about class and race in Vermont. Those things, those aren't an issue here. Everybody's got money and everybody's white. I'm like, well, no. People of color have lived here for always, and to erase that is unacceptable. So intersectionality is both about language, it's about visibility, it's about intake forms. It's also about valuing people as whole bodies. And when they come to your care and you just see them as somebody who's transgender, somebody who's a lesbian, somebody using a wheelchair, a person who uses drugs or does sex work, when you just see me as that one piece of my identity, you're missing my complete wholeness, and you're actually making it harder to help and serve me. We've gone from this world of specialty care, and we're desperate for primary care. And we're desperate for holistic primary care. Please guide us beyond white Western models of medicine to embrace global medicine, to embrace herbal medicine. Vermont's ripe for that type of change. So I could see so much potential in the network, and the opportunities for intersectionality are everywhere, but it's really about that whole person, whole care model that we've heard about all day long.
Before you give the mic, you said person-centered care, and I think sometimes in the work we use words that maybe mean different things to different people. Before you give the mic to Debbie, would you just say what person-centered care means to you?
Yeah, this is for me some low-hanging fruit. It's always person first. There was a recent 7 Days article about the Decker Towers residents, and it pitted them against the drug users. Drug user is not a respectful term. Person who uses drugs, person who's using substances, person with substance use disorder, if that's how they identify. When we don't lead with the person, we're leading with the behavior, with the identity, with the infection, and it's a little, might feel like a little shift, but it's a huge power play. We all have interpersonal and individual power. That individual power can look like a lot of internal self-talk and listening to what you're actually saying. But in those moments when you're speaking to other people, to center them first, you're seeing them as a whole person. So think about your language everywhere. We've been trained really poorly in white supremacy tools. We all have a lot of unpacking to do, some of us more than others. So getting into that language and using person first it's a good start.
Thank you. Debbie, how do you stay committed and dedicated to your professional causes? And at the same time, how do you explain Vermont's self-idealization to others as a barrier to DEI growth?
Okay. So,
Okay. She said, okay. Okay.
Let me just start off by saying I am the only Black director at Central Vermont Medical Center. And when I walk into a room, and first I kind of stood back, realized that I'm in a room full of powerful, privileged people who don't understand where I come from. Who make comments all the time about, oh yeah, you know what? You are so smart. What does that mean? I'm so smart. So to be Black in healthcare in Vermont is constantly exhausting. We are constantly repairing what we learn so it will not cause harm to the next generation's hope that will have an impactful, successful future in the profession of nursing, because that's my profession, is nursing. And I want to make an impact on the next generation so that the next generation of non-white people who move to Vermont will feel empowered to make a change and be accepted. What was the second question?
How do you explain Vermont's self-idealization to others as a barrier to DEI growth?
Well, the barrier is invisible. It has been created to keep people like me out, but it's a labor that I have accepted in order to dismantle a system that has not been created for me. I'm determined to be a part of a culture that will rebuild to include all humans. So that's my commitment.
What do you wish others would do to join the work?
I want everybody in the room to acknowledge, first of all, that the barriers exist.
Mm.
And then I want you to look at each other and I want you to truly hear what I'm saying. You need to become comfortable with being uncomfortable. I believe this beautiful floor, this beautiful environment that was created in Vermont was built to be an inclusive environment to keep everybody else out. It's beautiful here. You can't go anywhere in Vermont that you don't encounter a bear or some sort of animal, a deer. You don't build. There's a 501 something law in place, so you can't build here. So it was created to be inclusive of white privileged people. And I know by saying this openly, I'm putting myself at risk to when I go back into my environment that I don't know what's going to happen. But I'm going to speak my voice. You know, I give a lot of gratitude to Guadalupe, who has helped me identify my voice and be strong in saying how I feel and not be ashamed about who I am.
I am grateful to be asked to be amongst your group. My work as a disruptor has put me in positions of being labeled a problem. My work as a whistleblower has put me in positions of being labeled not credible and blamed for the systemic problems I have reported. There is fear for all of us to be here, and we have trusted all of you with our stories. I'm grateful to the UVM Health Network, but specifically my professional home of CVPH, for believing in me even though I come with labels because of the work that I do. I hope that you all have listened to these amazing humans and spent your time thinking about how to take action after this conference to join the work. Solidarity means using your power and privilege to protect those disruptors and pollinators who are labeled but are still fighting toward liberation of all to reduce health inequities. We have given you our stories, but we have not given you permission to share our stories. We want you to create your own story to share in solidarity to everyone's liberation and health equity. Thank you for listening. Dr. Coleman told me I had till 4:45 to shorten it, and I got done 1 minute early. You're right about that.
And and left me speechless. But I have the privilege of being great friends with Aaron. And I thought I was going to get through this summit today without crying, but I should have known when we asked Aaron to close it and to host this panel that was not going to happen. Deep gratitude to all of you for sharing your stories and for modeling for us how to lead with vulnerability. I think about something you said, maybe it was the summit last year, the very first one, when you were explaining how, really proclaiming that emotion is your superpower. I think about that every time that I feel scared at work. So thank you.
All right, so thank you so much to all of you. I think definitely made me emotional, a little bit more than I wanted, and so I wasn't ready for that. So thank you again, and we wanted to make sure we closed out today with a big, sincere thank you to all of you for joining us. This was truly a labor of love, and we hope that you experience that and you're able to take some actions and strategies back into your own spaces and continue the collaboration that is clearly shown here and amongst the whole day. So with that being said, we just have a few reminders. We will make sure to send you all more information on continuing education credits, and that'll be emailed out, but you can also find it online in our site. Please check the SCED app for more information. We do have a survey that's available, and we would love to continue, as mentioned, Marissa mentioned, doing this year after year, making sure we improve. So any feedback you have for us, we'll be really grateful for it. And then one last thing, there are still a merch table upstairs, and you're welcome to purchase. All of it will continue going to next year's summit, so it will continue being accessible to us all. So thank you again, and we hope you enjoyed the day.
And before you go, I just wanted to acknowledge Marissa Coleman and Guadalupe Martinez for this fantastic summit. This was my first. This was their third. This was amazing. And, oh my goodness, I am speechless. So I just wanted to thank everyone, and just a real shout out to these two phenomenal people who put the summit together.
Thank you, everyone. Thank you so much to all of you.